Where is the liver located? The liver is located in the right upper part of the abdominal cavity, just below the right diaphragm. The diaphragm is the muscle that separates the abdominal cavity from the chest cavity. What are the functions of the liver? The functions of the liver may be divided into synthetic function, metabolic function, and detoxifying function. Synthetic function means the liver makes certain clotting factors and a protein called albumin. Metabolic function involves the liver processing lipids or fats and stores glucose as glycogen. Detoxifying function, the liver produces a waste product called bilirubin and detoxifies certain drugs or medicines. What causes fatty liver? Fatty liver has a new name called Metabolic-Associated Fatty Liver Disease or MAFLD. From the name, we can deduce that the causes of MAFLD are obesity, diabetes, and dyslipidemia. How does fatty liver progress? Fatty liver progresses from mere accumulation of fat or steatosis to accumulation of fat with inflammation or steatohepatitis, and finally cirrhosis or liver hardening, which is the final common pathway of all chronic liver inflammation. What are the impacts to the liver functions? The liver has tremendous functional reserve. It will only decompensate when the insult, be it severe inflammation or cirrhosis, outstrips its functional reserve. Once this has happened, the patient will become jaundiced, confused, bruises easily due to deficiency of certain clotting factors, with fluid accumulation in the abdomen and lower limbs due to low albumin and increased liver pressure. Who are at risk of fatty liver? Not just people who are obese. Merely being overweight puts one at risk of fatty liver. Some people may have a normal BMI, but they have central obesity, meaning waist circumference of more than 90 cm in men and more than 80 cm in women. They are also at risk, as with diabetics and people with abnormal lipid profile. Fatty liver is a disease of affluence. What are the signs and symptoms of fatty liver? Fatty liver per se is asymptomatic. Sometimes a fatty liver may be enlarged and can be felt below the lowest rib on the right side of the abdomen. However, a person with fatty liver may have signs and symptoms of metabolic syndrome. Of course, a person with a hardened, failing liver may become jaundiced, have abdominal distension due to fluid, lower limb swelling, and bruises easily. How is fatty liver diagnosed? First of all, the patient has to have the right profile. Fatty liver may also be picked up on ultrasound, but ultrasound at the end of the day is subjective and observer dependent. Fibroscan, on the other hand, is objective and can quantify the degree of steatosis or fat infiltration. On top of this, Fibroscan can also assess the degree of fibrosis before the liver progresses to cirrhosis. Is fatty liver curable? What are the treatments available for fatty liver? Fibrosis can be reversed before it progresses to cirrhosis, which is irreversible. The cure for fatty liver is to deal with its underlying causes of obesity, diabetes, and dyslipidemia. What are the consequences if fatty liver is left untreated? Fatty liver will progress from mere accumulation of fat or steatosis to accumulation of fat with inflammation or steatohepatitis, and finally cirrhosis or liver hardening and liver failure. How to prevent fatty liver? As pointed out earlier, fatty liver is a disease of affluence. Prevention is of course better than cure. One could prevent fatty liver by adopting a healthy lifestyle, a balanced diet with plenty of fruits and vegetables, regular exercise of 20 to 30 minutes at least 5 times a week to keep the weight down, a BMI of less than 25 or even better, less than 23, which is the Asian standard, and a waist circumference of less than 90 cm for men and less than 80 cm for women.
Pharmacists can be an invaluable source of information for patients suffering from fatty liver. The advice given from pharmacists can cover both the non-pharmacological and also the pharmacological approaches. From the non-pharmacological aspect, 2 important considerations are weight loss and alcohol intake. Pharmacist-led counseling can aid patients in achieving their weight loss goals through diet and exercise. Where applicable, pharmacists can also provide advice on the benefits and the steps that can be taken to keep one's alcohol intake under control. which in turn can benefit patients suffering from certain types of liver disease. Your doctor may prescribe you some medication as part of your treatment for fatty liver, as well as to manage other comorbidities. The pharmacy team is responsible to help provide you with the information you need to take these drugs in the right way so that you can fully benefit from it. Pharmacists can also provide advice on certain supplements that can be used as supportive therapy for patients with liver disease. For example, silymarin, which is an extract from a herb called milk thistle, has antioxidant properties which may help protect your liver cells from damage. It is important to only choose registered products that have been clinically tested. It is not advisable to consume unregistered products without clinical studies, as it may contain substances which are toxic to the body. Before starting on any supplement for liver disease, it is therefore best to discuss it first with your healthcare professional who is treating you or who is familiar with your condition. In this current era of online searches and social media messaging, it is often difficult to assess what information is actually reliable, which can be used to help manage your condition. As such, your first point of contact, if you have any doubts, should be the doctor treating you or a pharmacist who is familiar with your condition. There are also several trustworthy online resources such as Medline, where you can go to find out more about your condition.